can't tell if we have a quorum yet. We don't. We have Dr. Ojo, Dr. Council, Dr. Dean, Mr. Larch, and Dr. Alsabi. We need one more.
Do you think there's anyone else that dialed in?
Yeah. Are we able to see if anybody else is dialed in, but they just don't have their video on? Hi, everyone. We don't yet have a quorum. We need one more person to be on. Oh, thank you. We are waiting to see if we have a quorum. We need one more person to join in order to meet a quorum. Dr. Council is in the room with us. 1, 2, 3, 4. So we have 5 on, and we need one more for a quorum. Kelly, was there anyone else that said they were going to join that's not here yet?
Dr. Mamadou, Dr. Kiernan. Ms. Cox said she would join.
Okay. Let me check my email. Okay. Okay, we have a quorum now. Dr. Ojo, would you get us started?
Okay, so am I moderating or Dr.
We are having a hard time hearing you, so you might need to get a little bit closer to your mic.
Okay, can you hear me now? Can you hear me better?
We still aren't able to hear you.
Okay. So I am on my phone. Can you hear me better now? Can you hear me?
I can hear you.
I can hear somebody talking. Give us just one moment, we're checking. Okay, Dr. Ojo, can you try one more time?
Okay, I'm here. Can you hear me now? Better?
Okay, now we can hear you, but we're getting an echo. That might be on our side. Just give us 1 minute.
Can you all hear me?
I can hear you.
Okay, shall we start the meeting? I welcome everybody on board. Can you please introduce yourself? My name is Olushola Ojo, pharmacist representative.
Can you guys hear us?
Yes.
Okay. I think we're okay then. We can hear you, just talk very loud. For whatever reason on our side, the sound is faint. So Dr. Ojo, we are ready for you.
Okay. Welcome on board and good afternoon to everyone. Can you please introduce yourself?
This is John Larch.
Welcome, John.
This is Hakam Osaidi.
Welcome on board.
And Dr.
Cynthia
Ken,
Carney.
please mute yourself so we can hear you.
This is Cynthia Kearney, nurse representative.
Welcome on board.
This is Jeanette Council.
Jennifer
Welcome,
Green,
Ms. Council.
Hi.
Jennifer Green, Health Department Director.
Candy York, accountant.
Welcome, Dr. Welcome,
Kelly
Ms.
Smith,
York.
administrative assistant.
Are we missing anyone else?
That's all that we have in the room today.
Okay, my name is Olushola Ojo. So do we have a quorum?
We do.
Good. Shall we observe a simple minute of silence just before we start the meeting? Okay. I wish to thank all in attendance for your willingness to juggle your busy schedule and to make this important meeting. This is a call and special meeting of the Cumberland County Board of Health to vote on the new flu vaccine rate. The proposed rate, if we all agree on it, will be presented by Dr. Green, Director of Cumberland County Department of Public Health, to the commissioners next week. May I ask for motion to approve the agenda for today, please?
Approve the agenda.
Seconded by?
I'll second that motion.
All in favor?
Aye.
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 Thank you. Now let's move on to item 2B. May I please call on Mrs. Candy York to please present the proposed flu shot fees and the rationale behind it?
Yes, ma'am. Good afternoon. Just want
Good
to be sure
afternoon.
everyone can hear me.
Yes, ma'am.
Okay, great. Thank you. Okay. Generally, as you know, the fees for the health department are approved during the budget process. However, the flu vaccines are an exception to that because the rates are never assigned by CMS until later in the year. At the time that the flu vaccines that will be utilized during that flu season will be actually accessible to us. This year, our 3 vaccines that we have that was included in the packet are the Flu Zone High Dose 65 and up, the Flu Block we use for 50 to 64 years of age, and then the Flu Preservative Free for 36 months and up. Each one of these rates, the CMS approved rate had increased from what it was prior fiscal year, and so therefore we are asking approval based on the analysis that we do to administer fees, which includes the acquisition cost of the vaccine, what the Medicaid or CMS rate is, what third-party rates are, and then of course the type of vaccine being administered. Our goal, though, is always to keep our rates at least at the minimum of the Medicaid CMS approved rate, and therefore we are presenting these 3 vaccines to you to increase the rate. We're asking for the Flu Zone High Dose 65 and up to go from the current rate of $50 to $61. The Flu Block 50 to 64 years to go from $45 to $61. And then the Flu Preservative Free 36 months and up from $19 to $20. And I'll be happy to answer any questions in regards to this request.
Do we have any questions?
Need a motion.
Yes. And if there's no questions, then I would just need a motion to approve the rate increase, please.
This is Jeanette Council. I move to approve the rates.
This is Cynthia Kearney. I second that approval.
All in favor?
Aye.
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 Okay. I wish that's about it. Thank you all for your attendance.
Dr. Ojo, we have
May I
one
ask
additional piece of information we need to share.
I'm
Okay,
sorry.
go ahead,
Yeah.
please.
I did it separate, just in case there was different questions about regards. So for this flu season, the health department is going to receive vaccines that will, from the state, that we'll be able to administer to uninsured and underinsured adults free of charge. In other words, we're not having to purchase the vaccine. And so in addition to the rate increase for the flu vaccines that we will be billing if a patient has Medicaid, Medicare, or third-party insurance, we're also asking approval that we will waive the fee for uninsured or underinsured adults based on the premise that we are receiving free vaccine from the state to administer. You know, usually we always have vaccine that we are able to do under the Vaccines for Children program that offers free vaccines for children. But this year they added in where we can actually administer to adults. So we want to also get a motion to approve to waive that fee for those particular patients.
Any comments on that?
I move that we approve this information.
Seconded by?
This is Cynthia Kearney. I second the approval.
All in favor?
Aye.
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 Thank you. Do we have any comments, public comments, board of members comments?
No, ma'am.
Okay. Thank you very much for your time. Thank you for your attendance. May I ask the motion to adjourn the meeting? Motion to adjourn the meeting?
I motion to adjourn the meeting.
Second.
Thank you, and have a great weekend all.
You too, thank you.
Thank you.
Thank you.
Thank you.